An injury or a cut on the body always causes bleeding, but the body has the ability to stop bleeding through clotting. Blood clotting or coagulation is an important process that prevents excessive bleeding when a blood vessel is injured. Platelets, which are a type of blood cell, and proteins in blood plasma work together to stop the bleeding by forming a clot over the injury. However, if the blood clots inside the veins or arteries, it leads to a fatal condition, medically referred to as thrombosis.
Thrombosis is a very bad disease. It's where blood clots in the blood vessels.
Dr. Dungu says patients with blood clots tend to ignore the signs and symptoms it exhibits.
A patient will present with a feeling of discomfort, a feeling of fullness in the lower limb, associated with swelling. Sometimes they develop like warmth, it becomes hot. But sometimes you may not even get those. Something comes, you feel like you have a muscle pull, you ignore that, and then you go away. Other people, when this leg gets swollen, of course they'll think this is witchcraft. It's very, very common for us to imagine that someone has been bewitched. They call it a talo. And they tell you don't go to hospital.
The disease is more prevalent in people above the age of 45, but a number of other factors can trigger the clot.
For example, you're undergoing surgery for a broken bone. We are going to keep you in a state of immobility for a bit of time. And whenever you leave blood from flowing naturally, it is going to clot, because where there's no flow, it stops. You should always have that dynamicity of the blood flowing.
A clot formed in the upper limbs of the body is not as harmful as the one formed in the lower limbs,
because these ones tend to be smaller, the upper limb clots, than those in the lower limbs.
There is no study that has been done in the country to establish the burden of the illness in the country. But Dr. Dungu says it is among the leading causes of death in our hospitals. The World Health Organization established risk factors after carrying out research on the disease in 2001, and some of these included previous deep vein thrombosis, a history of deep vein thrombosis in a close family member, use of estrogen therapy or oral contraceptive pills, hormone replacement therapy, pregnancy, recent surgery or trauma, particularly to the abdomen, pelvic region or legs, cancer, obesity, some inherited blood clotting abnormalities. A clot in the brain can lead to stroke, and if it goes into the lungs, a patient may breathe with difficulty and experience chest pain.
And each time you try to breathe in, it's extremely painful on the side where the clot is. Some people, depending on the severity of the clot, might get really, really bad symptoms, including collapsing, including forming like foam around the mouth.
Thrombosis is diagnosed using the presence of risk factors and signs believed to be the leading causes of the illness. Dr. Dungu says the disease is treatable if diagnosed early.
We need a very high index of suspicion, because there are so many people who are going to get a swollen leg. We have criteria to follow. Once you get a blood clot, naturally it will start breaking down, and we are able to catch those breakdown products through a test called a D-dimer.
He also made some recommendations on how the disease can be prevented.
It's very, very important that you always do exercises to stop thrombosis. Moving your legs, moving up and down the plane, it helps you for blood to flow, and not to drink a lot of coffee or alcohol when you're flying, because when you do that, then your blood is going to get so dehydrated.
13th of October was set as the World Thrombosis Day to raise awareness about the disease. Dr. Dungu calls on the government and other stakeholders to put more effort in preventing and treating the condition.
As a country, we may have the capacity to treat, but it's not enough. We have less than 10 maybe qualified hematologists. They cannot cover the entire country.
Research from the World Health Organization shows that blood clotting could be as a result of longer hours of seated immobility, which includes traveling over long hours. Now, this means that the ability of your blood to clot could also be detrimental to your health. Medics advise that in case you do a job that requires you to sit for long hours or travel over long distances, you endeavor to exercise in order to keep the blood flowing. Walter Mwesije, NTV.